All right, guys. So we are going to be going over the blood supply of the vertebral column and the spinal cord. It's important when we think about these to kind of keep these separate. They will be interlinking, but we want to think about the vertebral column and the spinal cord separately when we kind of get started here. So we're going to start with some of the arterial supply. Now, in the cervical, thoracic, and the abdominal region, these are going to have a little bit of a different branching pattern, but we're going to start with the cervical region. So in the cervical region, we know coming off the top of the heart here, we're going to have our ascending aorta. We've got marked number 1, and that's right here, which is our ascending aorta. Now, on this right side, we'll have the brachiocephalic trunk. On the left side, it just goes over to that subclavian. But this ascending aorta comes up, it branches over here into the brachiocephalic trunk, and then right here we're going to have our right subclavian artery. Now the subclavian artery is going to further branch out into the vertebral artery, the ascending cervical artery, right here, number 2, and then the deep cervical artery. So if we look over here at our picture, there is our vertebral artery coming up. You'll see it will have some branches. Now the vertebral artery, we know, is going to travel through the transverse foramina of the cervical vertebrae on its way up. Both vertebral arteries will merge up here to create the basilar artery. Up here would be our circle of Willis, which is supplying the blood flow for the brain. So that's our vertebral artery, but also right here, the next artery we have is our ascending cervical artery, and that's going to be right here. It's giving off some branches as well. And then our third is our deep cervical artery. That's coming off right here, and it will be giving off branches as well. So the vertebral artery is going to give off the anterior spinal artery. And what we see here is that the vertebral artery comes up, and it's going to connect right here, right before the two vertebral arteries connect to go to the basilar artery. They'll give off this branch here, which is the anterior spinal artery. And if we come back, this is our anterior spinal artery right here. And you can see that that will travel along the whole anterior portion of the spinal cord. And it's just one artery in the back. The posterior spinal arteries will be 2 in the back. One of these is the anterior spinal artery is just 1 in the front. Now you can see here is that, right here we've got our arachnoid matter. There's our thicker dura here. Our arachnoid matter is right here. And then there's our pia mater. So these will be sitting on the outside of that pia mater. Below the dura and below the arachnoid matter, we'll have all of our blood vessels. So our vertebral arteries, they go up, and before they join to make the basilar artery and go up to the circle of Willis, they give off these branches that come down the center on the anterior side, and that's the anterior spinal artery. Now the anterior spinal artery will also give off the sulcal arteries, and those are going to be supplying about 2/3 of all of the blood supply to the spinal cord. So if we come back right here, you can see here's our sulcal arteries. They're coming out into that anterior portion of our gray matter there, and then also to the posterior. So they're supplying the blood supply for a large portion of the cord, the sulcal artery, and that's coming off of this anterior spinal artery. So that's going to be one of our important ones to know. You also have the posterior spinal arteries. Those will be given off by the posterior side of the, here we can see, here's our posterior side of our spinal cord supply. Here's the anterior, where we saw our anterior goes right down the front, but here on the posterior side of the cord, here's our vertebral arteries, and they're giving off, once again, these posterior spinal arteries, which will go on. And later, right here, we see there's our posterior spinal arteries, and then they will branch off it right back here to supply the posterior portion of the cord. So coming back, that's going off the vertebral artery. Now, our ascending cervical artery, which is going to be our second one, number 2 right here, our ascending cervical artery, will give off the anterior segmental medullary artery, which you can see here, anterior segmental medullary arteries, and then the posterior segmental medullary artery. Now those are basically going to be providing extra blood supply for regions that need it. So you'll see these medullary arteries are going to be more common at the cervical enlargement, which is what we're seeing right here. It's an area of the spinal cord that is larger in the cervical region. And then also we have lumbosacral enlargement, or the lumbar enlargement, which is down here somewhere. Let's take a look there. Down here, there we go. So there's our lumbar enlargement right there. So these medullary branches are going to be basically providing extra blood flow. So these segmental branches are coming off in the cervical region off of these ascending cervical arteries. And they're segmental branches because they're going to come up and then perforate in, kind of following the path of the spinal nerve or the spinal nerve roots. So they'll be going through the intervertebral foramina. So if we come back here and we look, here are our anterior and posterior segmental medullary arteries. You can see there's our medullary artery, and here's another medullary artery. You want to be careful not to mix these up with the radicular arteries. We're going to talk about those. The radicular arteries are actually supplying the nerve roots themselves. So you'll have an anterior radicular artery right here on the ventral root, and then you'll have a posterior radicular artery that's supplying the dorsal root. And to figure this out, you're just going to have to look and see where the artery is going. So this artery is actually going to the rootlets itself. You can see there, and this is going to the rootlets. So those will be radicular arteries. But these segmental medullary arteries are actually going to come in, and then they eventually anastomose, or they fuse their blood supply with this anterior spinal artery. So if you can follow this artery from the spinal nerve down the roots and all the way over here to the anterior spinal artery, then you know that that's going to be a medullary artery. And they're basically providing anastomoses, which is extra blood flow. So you have different ways for blood to flow, and they'll be helping to innervate some of these nerve roots and some of the cord tissue in areas where you may not have a radicular nerve present, or I'm sorry, a radicular artery. And then the deep cervical artery as well. Here's our deep cervical artery, and it will also be giving off, you can see it's giving off branches a little bit higher up, whereas our ascending cervical artery is giving off some of these medial or mid-section branches in the cervical enlargement. They're also giving off anterior segmental medullary arteries and posterior segmental medullary arteries. So anytime you see segmental, you know that it's going to be entering through the intervertebral foramen, so the actual foramina between the vertebrae. Is where those segmental arteries will be coming in. And you know that if they're medullary, they're going to need to go to the cord and basically hop on to this anterior, or for the posterior segments, they'll hop on to the posterior spinal arteries. So if you see spinal artery, those are going to be longitudinal. They're traveling up and down the actual spinal cord. So you see spinal artery, anterior spinal artery, right here, anterior spinal artery, traveling longitudinally, one of them on the anterior portion of the cord. Posterior spinal arteries, two of them traveling longitudinally, which is vertical, up and down the posterior aspect of that spinal cord. So coming back, getting into the thoracic region, so these are going to be a little bit different, but similar. Now we're in the thoracic region, so we're actually going to be coming off of the heart with our ascending aorta. We're going to travel through the aortic loop and down now into the descending aorta. After the descending aorta gets further down into the spine, then it becomes the thoracic aorta. The thoracic aorta is going to give off two branches. You're going to have the posterior intercostal artery, that's one, and then you're going to have the dorsal branch, and that's two. Now the dorsal branch is going to be supplying the facet joints, the lamina, and the spinous processes. So we'll be keeping an eye out the posterior portions of the vertebrae, facets, lamina, spinous process. That's from the dorsal branch, so that makes sense. And then the posterior intercostal artery will give off a periosteal artery and an equatorial artery, which are going to be supplying more to the actual periosteum, which is the connective tissue wrapping of the bone. And then the equatorial artery will be supplying, we're looking then at the vertebral body itself. So if we look up here, we can see here's our posterior intercostal artery. That's basically just going to be a branch coming off of the thoracic aorta. And then that will go forward to branch off into some of these that are going to the actual vertebral body. And then you also have the dorsal branch, which is further here. Now this is a lumbar vertebrae, and so you'll see that this is interchangeable. This says lumbar artery right there. If I come here into the abdomen, now we're looking, see, we've got our lumbar artery coming off of our abdominal aorta here. Here's our lumbar artery. That will branch into a dorsal branch as well as the equatorial divisions. Here's our equatorial branches that are going to the vertebral body. So in the thoracic region, you would just mentally you can just replace that lumbar artery portion with the posterior intercostal artery. So I've labeled it here. Here's the posterior intercostal artery. If we were in the thoracic region here, which I don't have a good picture, unfortunately, but if we were in the thoracic region, then you would have that posterior intercostal artery. So you can see right here, posterior intercostal artery, it's coming off of this thoracic aorta. Boom. It's going to give off a spinal branch, which will go into the cord. That will go. The spinal branch always goes through the intervertebral foramen, whereas the other branch, the posterior intercostal artery, will then bifurcate. So it'll give off different sections. So we've got our posterior intercostal artery. This has basically come right off of that thoracic aorta. The periosteal artery, which we can see right here. Periosteal are going to be giving off branches for the actual surface connective tissue that'll go onto the spinous processes, onto the transverse processes, and don't forget you've got periosteum all over this. The equatorial artery is in purple. There's our equatorial branches. You can see them. They're innervating that vertebral body on the anterior portion or on the outside there. Then you have the dorsal branch. The dorsal branch is going to be right here. So we're seeing this as we're looking posteriorly. We give off a dorsal branch. The dorsal branch basically bifurcates into a spinal branch and a continuation of the dorsal branch. So here's the dorsal branch. If we follow it along and we continue all the way back out here, that's the terminal ends of the dorsal branches. This will go to some of the musculature of the back. This will go to the cutaneous or to the skin of the back. And it also comes over here to supply the spinous process and the lamina. So you can see where it's saying the dorsal branch is supplying the facet joints of the lamina and the spinous process. Well, that's a continuation of our dorsal branch that comes back to accomplish that by going here. And then it will go internally. You can see that, maybe you can't see super well, but there's the internal structure of it. But the dorsal branch will have a split off of it, and that's the spinal branch. The spinal branch is always going to be traveling through the intervertebral foramen to make its way here into the neural canal, where the spinal branch, which you can see here's our spinal artery, right, is coming in, spinal branch. It will give off the anterior vertebral canal artery and the posterior vertebral canal artery. So if we look, here's a better picture of these things. Here we're going to see the anterior vertebral canal branch. So our spinal branch comes on in through the intervertebral foramen. It's going to give off an anterior vertebral canal branch. There that is, which will go in and supply the body of the vertebrae, the vertebral body. And then you also have the posterior vertebral canal branch, which will go back and it will supply more of this pedicle and kind of lamina area. And so that's going to be our thoracic region. Now, this is just, again, slightly different when we get into the lumbar or the abdomen region. In the abdominal region, now we're going off of the abdominal aorta, and that will branch out into our lumbar arteries. So now our picture kind of makes sense because there's our abdominal aorta, here's our lumbar artery traveling right there. That lumbar artery basically gives off the periosteal and equatorial arteries. Here we're seeing the equatorial arteries that are coming off and supplying the anterior portion of the vertebral body. And then you also have the periosteal segment. So if we continue to follow the lumbar artery all the way back down here, we have an anterior continuation, a posterior branch of the lumbar artery, and we see that it's giving off these periosteal branches. And here is that posterior branch as well, giving off these periosteal branches, but they're still from the lumbar artery. Now, were this the thoracic region, that would be the posterior intercostal artery. So they're used interchangeably, but they're different based on which segment that you're actually in. So abdominal aorta gives off our lumbar artery, and that's going to go here. But the lumbar artery will basically split, and it's going to have, then you'll also have the spinal branch, which is going to take it in. So the lumbar artery will have a spinal branch. We're having that lumbar artery come on through. Here's our spinal branch here. Spinal branch comes in just like we did last time. We've got anterior vertebral canal, posterior vertebral canal arteries. So our anterior vertebral canal artery right there, going to the vertebral body. Posterior is right here, going to those pedicles. Okay, and then you also have the posterior branch. Now you would call that the dorsal branch or the posterior branch, right? That's the one that comes all the way back and talks to these spinous processes. So those are going to be similar just based on how they are arranged versus thoracic and lumbar. Okay. Now when we get into the venous supply, the venous supply is basically going to follow the same process but in reverse. So in the arterial side, we have these big vessels like the abdominal aorta. We go to a smaller vessel like the lumbar artery, and then eventually to smaller vessels like the spinal branch and your terminal branches. Well, after those go into the tissues and they exchange their nutrients and wastes, then they're going to need to come out of those tissues. So we're going to go in reverse order with our venous supply from small vessels to larger vessels. So this is obviously a lumbar vertebrae. We're going to use it as an example for everything over here. So when we're starting from the vertebral canal, basically we're going to have an external vertebral venous plexus, which is going to be external on the outside of the vertebral canal, and it's a venous plexus, so these are these kind of thick tanglements of veins. So you're going to have an anterior and a posterior. The anterior external vertebral venous plexus is going to be right here. We see internal, external vertebral venous plexus. You're going to have a whole network of blood vessels on the fronts of those vertebral bodies, kind of adhering to that anterior longitudinal ligament. I think they're actually deep to that. You'll have to double check me on that. And they're going to be draining from the basovertebral vein. So you can't see super well right here, but here's the basovertebral vein. And that basically perforates the vertebral body. So after the vertebral body gets its blood from the arteries, it will then need to drain that through these basovertebral veins. Now, the anterior portion of that vertebral body is going to drain out here to these anterior external vertebral venous plexus. The posterior external vertebral venous plexus is actually going to be back here. So here's our posterior external vertebral venous plexus, and it's going to be basically wrapping itself all around the spinous process and these transverse processes here, and it will drain the blood that is bringing nutrients to the spinous processes and the posterior elements of the vertebrae. Next, we have an internal vertebral venous plexus, and once again you have an anterior and a posterior, but now you're going to have two. So the anterior and posterior internal vertebral plexus are paired. So here's our anterior internal vertebral venous plexus. You're going to have one right here, and you have a matching set on the other side for the anterior. And then your posterior posterior internal vertebral venous plexus, you're going to have one set right here and another set on the other side. So you've got two of the internals, but only one of the external plexuses. The anterior internal vertebral venous plexus also drains from the basovertebral vein, and that makes sense because if our basovertebral vein is right here in the center of the vertebral body, the anterior portion of the vertebral body will drain into this external plexus, anterior external plexus, while the posterior portion of the vertebral body, it really can't jump and make this jump out here, so it's got to drain into these anterior internal vertebral venous plexus. So just remember that the anterior plexus of the internal and the anterior of the external are going to drain those basovertebral veins. The next step after all of these vertebral venous plexuses are done draining blood is they're going to sync up with our intervertebral veins. The intervertebral veins, once you know, inter is meaning between, vertebral is vertebrae, so between vertebrae you're going to have the intervertebral foramina. So here is our intervertebral vein. So just like you'd have your segmental artery coming in, here you are going to have your intervertebral vein coming out. That's going to drain the anterior and posterior internal venous plexuses, so all of the blood that is being drained from this internal portion of these plexuses is going to then anastomose or fuse together and give off this internal vertebral vein, which will go out to communicate with whatever terminal branch is appropriate for that region. So below that we see our terminal branches here. You have the vertebral vein if you're up in the cervical region, posterior intercostal vein if you're in the thoracic region. This is a picture of a lumbar vertebrae, so we've got the lumbar ascending vein. So you can see here this intervertebral vein will come out, and then it will communicate with this ascending lumbar vein, which basically drains all down that lateral side of the vertebral body. And if we were in the sacral region, you'd have the lateral sacral veins. So those are the terminal branches that drain, and they'll either drain to the superior or inferior vena cava, depending on where they're at. There's also some other blood vessels that they could drain into, but that's probably a little bit past our scope. So when we're talking about spinal cord supply, this is on a macro level. You can see the whole cord here. This is the arterial supply for the whole cord. And then here's the micro level. You can see there's our arterial supply for the cord in red, and then our venous drainage supply for the cord on that micro level is in blue. So if we come over here into our cord supply, the anterior spinal artery we already talked about. We can see it right here. Anterior spinal artery is bringing blood all down the anterior portion of the spinal cord. That will give off the sulcal arteries, which give off 2/3 of the blood supply for our actual spinal cord. And here's our sulcal artery right here. You can see it's innervating that anterior and posterior gray matter there with just a little bit of arterial supply coming from the posterior spinal arteries. You're also going to have the spinal branch. On the spinal branches, you're going to have the anterior segmental medullary artery, which we've already talked about, but we'll look at it again. Anterior segmental medullary artery. Here it is coming in. Now we see we've got a dorsal and an anterior, right? So we've got a posterior, anterior, or we have a dorsal and a ventral segmental medullary artery. But we see that it's following along, and now it's fusing with that anterior spinal artery. So if we're seeing this fusion, it must be a medullary artery. Now we'll contrast that with the anterior radicular artery here. Anterior radicular artery over by this circle. The radicular artery is now not going to go all the way to that anterior spinal artery. It actually is just going to end at these little branch terminals here. And so the radicular artery is not to be confused with the medullary artery, which fuses with that anterior spinal artery. You have the posterior segmental medullary artery. You can see here triangle, posterior and anterior. Obviously the posterior is going to be going down here, down this dorsal root. There's our dorsal root ganglion, so we know that's the back. Travels down here. And since it's a medullary artery, that would, if we could see a posterior view of it, it would go down to fuse with these posterior spinal arteries. And because it's doing that, we know now that that is medullary. Posterior radicular artery is going to be right here, and we see there's our ventral root, there's our dorsal root ganglion, right? Spinal ganglion, that's our dorsal root ganglion, and this artery coming back here to supply that will be the posterior radicular artery. So hopefully that helps everyone kind of go over how this works. I spent a lot of time trying to put this together because I needed to help myself understand the blood flow and what arteries were going to the actual vertebrae versus what arteries were going to the actual cord. And I think over the course of the day, I've kind of cleared that up for myself. So hopefully that clears that up for you. And we can do really well on this gross test. So good luck, everybody.